and we're here doing conversations on a bench. I'm going to be sitting on this somewhat bougie bench for 24 hours, but it is cold out here already. I've added some layers and I've got a blanket, and um, but we're just here to talk about homelessness and highlight the issues. And I want to start by thanking our sponsors, Discovery Institute, and several food sponsors are providing coffee. Umbria is providing us coffee. And today for lunch, Conan Steiner provided lunch. So thank you so much for those who are helping us do this. So I have Barb Biondo here with me right now. And Barb, I'm going to ask you to kind of introduce yourself and what you do. Oh, just, we need to turn the mic on and pull
Okay.
it right up by your face.
All right.
There you go.
So, hi Kim. Thank you for inviting me. I'm actually was honored to be invited to participate. Yeah, I tell you a little about myself. I am a crime prevention coordinator here. I work for the Seattle Police Department, based out of the West Precinct. I'm also, and this is how I met Kim when she came to this role. This is the area I work in, and I also, and I'm here because I do this work here and I'm very passionate about the work I do, but I am not, to clarify, I'm not representing the Seattle Police Department in anything I say here, because I'm also, besides someone who cares here at work, I care where I live, and I'm involved in my own neighborhood council and have been involved in things like this, community improvement projects for decades now in Seattle. So.
Yeah. So you are very well aware of the issues around homelessness in the city.
Mm-hmm.
Um, do you think things are getting better? Or, I mean, the problem's getting worse. The
Mm-hmm.
numbers are worse.
Yeah.
But
Yeah.
where do you think we stand?
Definitely, we know the numbers are worse, and my concern is that it's it's winter, and it's here we are, heading in a direction we don't want to be in. So I'm really interested in, and part of the work I like doing, part of the what I like about the role is that I get to work with community-based organizations like yours and other people providing shelter and housing and support for those that need it. And one of the things I try to do is how can we do more with what we have, and then hopefully the people on the policy and decision-making level can help us find out where there are gaps so that we can do more sooner. Um, but I'm also an idealist, and so while I know there's urgency about meeting the needs of the people on the street right now and tonight, I also say we can do that, and we can do better as a country, I think, in terms of how we um, support those that are most needy in our society. And I think, there's a pathway. It's called social determinants of health.
Yes.
We know how to support communities and build neighborhoods so that basic needs are met.
Right.
And so we don't end up with this continual, I feel like, at my age, I feel like we're witnessing a life, almost my whole lifetime's probably, policy choices that brought us here.
Yes.
Policy choices that were made, policies that were maybe not enacted or not enacted at the degree or, level needed.
That's really important. One person can be homeless because of their choices, poor choices. But when you have this number of people homeless across the country, it is not about the individual anymore. It's policy.
Yeah.
It comes right down to it.
Mm-hmm.
We have to change some policies because the ones we have aren't working.
Yeah.
Or we wouldn't have homelessness growing.
Yeah, it wouldn't be growing. I feel like, I think too often we kind of get reactionary
Yeah.
about how we respond to things, and when there's people suffering, you need to react, and you need to, do it as best you can, and as an informed way as you can, and as in a compassionate way as you can. But you also need to plan to like, again, I really feel like, for the next generation, let's at least plant the seeds about where we know you need a safe neighborhood, safe
Right.
streets, safe parks, access. You need quality schools.
Yes.
And they need to support families,
Mhm.
you know, quality jobs, affordable childcare, all of those things.
Right.
I don't think those are anything beyond our ability to achieve.
Yeah.
So I don't want to neglect investing in our future while we take care of the needs of now. You know, so.
Mhm. Yeah, I think it starts in childhood. Not everybody is homeless because of something in their childhood, but many of them are. I have guys in the mission who tell me stories about, alcoholism, drug addiction, abuse in their backgrounds, and yet we blame them for being homeless, and really it's they have trauma from their childhood. They weren't
Yeah.
set up for success. So certainly it would help if we started with that early, start early on. And the homelessness in schools, students,
Yep.
is skyrocketing,
Yeah.
isn't it?
Yeah. So my, you know, so again, I want to move on two fronts, and each one is important. So I want to move with urgency. I hope as a society we can figure out how to do that. I also think that, I think we need. There's a lot of research out there that show us. We've known many years about risk and protective factors now, decades in
Right.
fact. UW researchers,
Mm-hmm.
um, you know, brought that out there into the world, and
Yeah.
people talk a lot about it. So we know those things. I just.
I was talking to Steve Burai from Discovery Institute, and I can't remember the four different. There's emergency, like when there's a disaster. There's disaster relief, and then there's another layer to that, and then community development
Yeah.
and life transformation. And really, I think a lot of the missions that we in Citygate, certainly for us, we're the first and the last one. We do disaster because the people are coming in off the street, and it's emergency services, and then we're doing life transformation work. But I think that there's a real gap in Seattle right now for the emergency part. What do you think about that? Like,
Yeah, I mean, I think, you know, we're looking at what shelter beds are available. I know that's being tracked. What I'm concerned about is that there's shelter, and then there's also places that provide day center and day supports and hygiene and those kinds of things too. And so I think there's, from what I understand, I hear places that had been open, and we didn't have that many to begin with, and we had a lot of, places, have lost funding and closed in the last few years. So we didn't have enough to begin with, and the few we had are closing. So I feel, we need to figure out what to do about that.
right.
Because everyone has to be somewhere.
Yeah, well, I
Right.
was saying that it's like a war or an emergency room. You have to get get them in and triage and
Yeah.
figure out who's emergency right now, who needs more time, whatever
Yeah.
it is. Some people
Yeah.
might just need help with one little thing, and they're fine, and others
Yeah.
need more long-term care. Yeah.
Yeah, so I would love, I read not too long ago a book by Andrew Fauci, On Call.
Okay.
Anthony Fauci, sorry.
Anthony, yes.
So he talked a lot about his work in public health, and he did a lot of research and work on the AIDS pandemic, and especially in Africa, and they found that you have centers that are like really high needs trauma centers, and those are very expensive to build out. But not everyone, like you said, has that need. There could be a whole, spectrum of levels of need along the way. So a way to cost effectively get people into the network at least and figure out where they belong is to build other levels of connected service points or shelters or where they have access to the case management support. If they're ready for treatment and they want to go there, if they need housing or other things to be addressed. And I could see us, now that we have some crisis centers online and beds and things like that, that we didn't have just a few years ago, that if we can build out these other, locations and connect them, I think we could move probably
Move the
more
needle.
quickly. I mean, we may need to still do some other things to make up for a gap in beds that are, when we determine what that number should be too.
Yeah.
But
Yeah.
I
I know our beds are full every night.
Yeah.
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 We've got a line out the door every night
Yeah.
for the emergency shelter, and our program is full. So
Yeah, and that's what we have a round table, as you know, you're part of it here, the shelter and housing providers and outreach teams. We're trying to connect better, and so that all those people providing those important services can communicate what they have, what their needs are, and once we know what's there, hopefully we can make some links and be more efficient. And
yeah, I love that meeting. In this work, it's really easy to just have a lot of meetings that you don't need. But this one is really good. I really like it because it helps us to see where the gaps are. It helps us to understand who's doing what. It's a good way to break down silos because, let's face it, there's silos.
Yeah.
Right.
Every society, I'm sure, has them. So there's private sector, public sector, and then there's, just within those sectors themselves. So that's good feedback.
Yeah.
And I'm really glad the Salvation Army has stepped up recently to co-host this. And meeting in person has been great. Even though I think people are still liking the convenience of jumping online, so we're doing hybrid, as you know.
Right.
But I think the other really wonderful thing is that you get that passionate intensity that people in your line of work bring, and it's so nice to be around other people like that care. And I've been touring some of the facilities because they're describing them to me, and I'm like, well, I can provide some crime prevention support, and I also want to see your facility, and so I've been, I'm learning constantly.
Right.
So
I know when people come for a tour here, the thing that I hear the most is, I had no idea. Right? You did a tour. Was it last spring?
When you hadn't been here that long, but there was already
maybe it was the fall before.
Yeah, there was already changes were apparent.
Yeah.
In the best way. Too.
Yeah, I think a lot of people think that we're just beds, like overnight beds, and like 3 hots and a cot, right? And we are so much more than that in rescue missions.
Yes.
So
and I've been to the ones that are receiving contracts from the city, and then those that don't, but they're like the Union Gospel Mission, Emmanuel. I've been to their facilities too. They're all part of our network as well. We share information, try to make sure they understand what services the city provides around public safety, but also just trying to I really think getting plugged in at the neighborhood level and kind of rebuilding community. I've said rebuilding the village, is really important because I think, that's certainly, there's a village feel about Pioneer Square. And so you're connected to the other providers and then the wider community.
You talked earlier, you mentioned social determinants of health. But most people don't know what that means, and we worked with that back in New York, so I'm pretty aware. But can you describe what that is for people?
Well, it's I'm certainly no expert on the subject, other than I do know from a crime prevention perspective that you need some basic things to be safe in urban environments. So the streets need, obviously need to be safe from a public safety standpoint. So that's, you don't want to be assaulted or attacked and things like that, but you also want to be able to, safely access and cross streets and things like that. So it's, safety on all levels. But it's more than that. But that's fundamental.
Right.
If we feel safe, we can go and take advantage of the things our neighborhoods provide, the businesses, the art, and the other amenities like public parks and those things. But you have to be safe to get out there, and if you're a senior and maybe have a disability, or you're with children, or you're got a couple of kids on their own that are want to hit the corner store. So the street environment needs to be safe. But then from there, you know, that then it gets more into the complexities of, you know, health. You know, do they have access to health care, and again, quality schools, or families supported with, you know, child care, and you know, teens offered enrichment programs and opportunities to participate in the community, and then, you know, earn money themselves and start to, you know, see the path to their future.
Right.
So they don't have to worry about what their opportunities are, that, you know, it's, they can look around, they don't have to go far to, community college is just up on the hill.
Yeah.
A short bus ride away is Central, right?
Yep.
So.
One of the ways that I've heard it explained that I really like is that 80% of our health has to do with things that are not health care related. We spend 80% of the money in healthcare on hospitals and all of the, which I call sick care, but we won't go there.
Yeah.
But 80% of our health has to do with things that are not healthcare related. Like, do you have access to real food?
Yeah.
Are you in a food desert?
Yes.
Can you get to the stores that have real food? Can you get meaningful employment? Do you have social support? Do you have, you know, are you lonely?
Yeah.
Like elderly people who maybe call 911 all the time just because they're lonely and they want somebody to come and just look at them and talk to them.
Yeah.
You know, and so how do we fill all those gaps? And what we do at the missions is, I think, it's all social determinants of health. But likewise in our communities, we have to have, like I was talking earlier to Renee about, we don't have public restrooms in Pioneer Square,
Basic
right?
things.
That's a social determinant of health.
Yeah, access to a clean, hygiene facilities.
Right.
Yeah.
Do you have water? Do you have, you know, a place to sleep? It's like Maslow's hierarchy of need a little bit, right?
Yeah, it is.
Yeah.
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 Yeah, I think of that too. I think, you had me thinking of another, something very related.
Part of what I was thinking is related that sounded like something you were talking about was complete streets.
Oh, yeah.
And so when we were doing social determinants of health back in New York, and we were much more, I was in a small city and there was a lot of rural there, but we were talking about complete streets intersect with social determinants because, you know, if the streets are safe for the youngest and oldest, then they're probably safe for everybody.
Yes.
So can your 75-year-old mom get to her healthcare appointments? Can she walk down the street to the market and be safe? Or is she tripping on sidewalks? Or is there crime?
Yeah.
Right? All of those things.
Yeah.
And it intersects with that social determinants.
Yeah, I think we could have a report card for our, and we have these amazing, what Seattle is a city of neighborhoods. You've probably heard it described that way.
Yeah.
And I think that's a lot of us who've been here a long time now, or natives of Seattle. That's a point of pride.
Yeah.
To have a city of neighborhoods that are also unique and you know, have their own charms, but you know, they could each have their own like social determinants of health. Grade. Do they have those things there? We have a lot of food deserts, more than I think ever. With the closing of the Crest IGA downtown, there's not a lot of access to groceries.
Right.
And we've got a lot of people living on limited income that was their local grocery store.
Right.
But I remembered the other thing, but yes, I love the idea of the streets themselves being something that wouldn't be so obvious, but it's critical. The other thing that came to mind was I did a year of AmeriCorps service, and there were a lot of AmeriCorps volunteers around in the 90s here in Seattle doing all kinds of things, and I'm looking around and I don't see AmeriCorps around anymore, and I wonder where the heck is AmeriCorps, and what if, I mean, there's so many, like the lonely seniors and and I've also thought of people in recovery. One of the I was able to, read some reports done by our city auditor's office. They looked at crime and overdose hotspots, and then they looked at, some different best practice for, people in recovery. Again, this gets way out of my area of expertise, but they did talk about, people in recovery that are actively, engaged in that process. They have time on their hands. They have energy that they used for other things, survival
and they need to build a new life.
They need to build a new life. So what if we added AmeriCorps? We have Recovery Corps.
I love that.
I love that. I know, something where it's you engage folks, and maybe there's access to community college, or GED or vocational training, and then giving back to the community.
Yeah.
There's any number of things when I look around that, we could use community volunteers. I mean, we did a heck of a lot of stuff back when I was doing AmeriCorps, and if anything, there's more need.
Yeah. I would totally sign up our guys.
Well,
for something like that.
We gotta.
That's actually our last, our Life Path program is built around 8 S words: from safe, sober, stable, schooled, skilled, secure, settled. And the last one is serving.
Yes.
Because when they have service, first of all, it gives them community. And we know that they're in a healthier place, so they're not ingrown. They're not looking in all the time.
Yep.
When they can look out, they're in a much better place emotionally and mentally.
Yep.
Right? And so we need to give them opportunities for that.
Yeah. Well, I would love to put our heads together and figure out how we can.
Let's do it.
There's other smart, creative people around here too. I know we could come up.
Yeah.
I hope we could come up with a way to do that, because I see that as a great, gaping need too.
When you're talking about recovery, people don't realize sometimes the simple things that these people need in recovery. And one example is our Christmas. We had a Christmas party for the program guys Christmas Eve. And we played a couple of games. And we told them up front, this is part of your recovery. It might not feel right, but you need to learn to laugh again. You need to learn to have fun without substances. And we didn't think they'd do it. We had this game where they were hopping from one square to another, and when they met, they had to do rock, paper, scissors. And then whoever lost, it was out. And they had a blast. They had so much fun. And they got it. Because one of the guys said, last Christmas, I was sitting in my place all alone in my recliner. And this year he was like laughing and enjoying community and celebrating Christmas.
Oh, wow.
Isn't that that was the highlight of my Christmas.
And that was like a probably low cost, no cost game too. I mean, it's just providing the space and the
we gave
setting,
them, we had a couple of prizes for the ones that, were still in. And we did another one where we wrapped up a whole bunch of gifts in plastic wrap. And they had to, it was like musical chairs, but with an oven mitt.
Yeah.
And whatever came out.
Whoever thought
I know, right? Whatever came out when they had it, they got to keep. And they had so much fun with that. Such a low cost thing.
Yeah.
But they have to learn community again because, and I hear Amy Barden talk about this all the time. Like, it's a lack of community, a lack of relationships that they're going down that addiction path. And we need to establish relationships with people again. We need to learn how to do that.
Yeah.
And that's just a simple way.
Yeah, we are. I always say community is a state of mind.
Yes.
So it's like you just have to remind yourself. I say I'm in community when I'm on the bus with a bunch of strangers because they're my, if anything happens right here and now, they're my peeps. We're going to figure it out together. And so, but I do bus commute a lot, so I do see some familiar faces every day on my commute. But I think you can look at community and that's just making eye contact and smiling at somebody that you pass down the street.
And that might be the highlight of their day. which is kind
Yeah.
of sad, but
Yeah.
if we all did it,
Yeah.
you know,
Yeah.
it's looking out from our phones, and I
Yep.
am the worst one to be
Yeah.
saying that.
Ooh.
But
Where's Tia? She's heard my personal safety talks.
oh yeah.
Oh yeah.
Oh well, tell us
Oh,
what that is.
oh yeah, it's about not looking at your phone when you're walking down the street. You need to maintain some awareness of your environment. So I teach them the way to do it, to be safe is if you got to check a text message or look at the grocery list, take your phone out, but then go stand by the bus stop or against a building and look at your message, and then put your phone back in your pocket before you walk back out in the street. So you're always, because we don't multitask well, and if you're looking at your phone and doing something there, you could miss
You're
something.
not safe. Yeah.
Related to how safe the environment is.
Where do you do these talks?
I do them all over the place.
Yeah?
Downtown with groups.
Okay.
Yeah.
So if somebody wanted you to come do a group,
Oh yeah.
a safety talk,
Yeah.
how would they do that?
Just reach out. Email is better. Don't call me. I have a hard time getting to all the phone messages, but email. Yeah, I can give you my email.
Go ahead.
It's my full name, Barbara, Barbara. Biondo, Biondo, at Seattle.gov.
That's great.
So I work in the West Precinct in Seattle. But I have colleagues that work in our other precincts I can connect you with. But yeah, we do that all the time.
I have to say, since I've come to Seattle, I've really been impressed with the city really trying to find new ways to do things and reaching out to partners and, you know, like somebody like us, Bread of Life, you know, it would be easy to go, yeah, they're just a religious nonprofit, you know. But you're opening your arms and bringing us all together, and that means a lot. And I see the city really trying to find what's going to work and trying new things, and I so appreciate that.
Yeah. I am proud to be part of city government because of that reason, and also the Seattle Police Department, because talk about, you know, doing more with less, you know, that's definitely what, you know, we're faced with.
Yeah.
But I see people in the precinct I work out of. I am, you know, proud to be a part of that team. They really care. They share things with me for follow-up when they think, you know, what they could provide was not enough to really help, you know, a business owner or a community member deal with the issue. So they send them my way, and then I follow up. And but yeah, and then there's a lot of other people in a lot of other positions in city government that are doing their utmost, you know, really thinking outside the box, and also in city leadership, I'll give them credit too.
Yeah.
You know, they're like, what can we do? Let's, you know, let's try this. We're doing some. Yeah.
And really, just in the last year and a half, even though homeless numbers are going up and there are some nasty drugs out there, I'm seeing that on the street, you know, the effects of that on the street. But on the other hand, I'm seeing certain things getting better. Even in the midst of that getting worse, I see that the things the city's enacting are actually making a difference.
Yeah.
So,
yeah, it's going to take a while. I mean, we didn't get here overnight, so it's going to take a while. But yeah, it's good to hear you're seeing improvements. I see them, and I see it's, you know, I think certainly city government can take credit for some of that. But I also think the community itself can for what you're all doing. And then, you know, the circle to square, you know, that connective, you know, that's friendly, and it's very grassroots. So I feel like COVID maybe shook. We're all coming out of that. Yeah, it shook everything up. We kind of are back on our feet, and now we're going, okay, the landscape's different. But, you know, we have a lot of potential here. There's a ton of potential. Yeah. With the folks and the resources that we have on hand. So it's just, you know, connecting.
I don't know if you're the one to ask about this, but I think you know probably enough to explain it. Would you tell people about Find It, Fix It?
Oh yeah, I tell them
that's
all about
amazing.
Yes, it is amazing. It is.
They're gonna get tired of me because I put stuff on there all the time.
No, it's a great, and it's gotten better over it's been out for a number of years now. The city's gotten better at, you know, giving us, you know, community members and also city employees. I use it all the time to report something that needs to be addressed. It could be, you know, someone ran over one of the crosswalk, you know, activators, and that's what I reported just recently in Little Saigon. Or it could be, you know, a garbage can's overturned, graffiti. But it's also where we have, if it's a non-emergent issue with someone that's sheltering on the street, you know, living in a tent.
If you see a tent.
Or a car, RV.
Mhm.
If it's an emergency, we want everyone to call 911.
Right.
But yeah, it's a great
Yeah.
way to get services out there,
Yep.
and have accountability too. There you
Right.
get tracking numbers, so
Yep.
you can follow up.
And that's important because they know then where the gaps are,
Mm-hmm.
and they can't be everywhere at once. But
Yeah.
if they have 5 different people doing a find
Yep.
it, fix it on a
Mhm.
tent
Yeah.
on the sidewalk, that's
It
definitely going to
gets
get
the
fixed
attention.
quicker.
Yeah, and it's
Yeah.
also, our city and certainly in society in general, I think we're becoming more and more data driven.
Right.
So we do look at where the reports are coming in, what kind of reports are being made,
Mhm.
and then we look at crime and calls for first responder services. We look at
Mhm.
that data all the time, and that's a good. If I could do one
Yeah.
message, it was like if folks out there are, if you're here wherever you are, and you see something or think something's happening that police should know about, but you're kind of
Not sure.
not sure. We always say, please just make the 911 call.
Yes.
Our dispatch team, and maybe Chief Barden said this as well, they're really good at getting, eliciting the information that helps them understand if a response is needed, and then if so, what's the best response.
That's
But
really
people assume, I tell folks, we've always been the eyes and ears of our police department. So
Right.
don't assume somebody else called. Please just make the call. We can handle the volume.
Yeah.
Yeah.
I think that's really, really important. When I got here, I was seeing stuff like, I don't know, people laying on the sidewalk, obviously having just taken drugs or
Yeah.
whatever. I was seeing issues and just people walking by. And where I come from, that doesn't happen. And
Yes.
I went, is that really just how it is here? And I was actually told, yeah, you just don't get involved. And the more I've talked to you and Chief Barden and other people, they've said, no, call about
Yep.
that.
Mhm.
And, if it's something where, maybe not police, but maybe a mental episode or
Mhm.
whatever, ask for the CARES team,
Yep.
right?
Mhm.
And they might not get there right away, but they know that, there's a lot going on in the city. But if they don't get the calls,
Right.
then they're not going to know where to put the
Right.
supports.
And it could be someone overdosed. I mean, if they're
Right.
not responsive, it
Right.
could be that that seconds are really going to be counting. And so
Right.
if you're the one making that call, or maybe they were, looking like they weren't doing well, and the person, maybe a call was made, but that second call might be the one that,
Yeah, it
gets
ramps
that
it up.
priority response.
Right.
If the situation changes, yeah. So please make
Mhm.
the call. You can always call back and cancel if the service isn't needed.
Right.
That's good to know too.
Right.
And people shouldn't hesitate to call back.
Yeah. And when I have called 911, like I get it's great service.
Yep.
I get an email or a text or something
Mhm.
saying, was this taken care of? And like
Yeah.
if we only had good customer service like that everywhere. So
Yeah,
they're really
that's
trying to
great.
make sure that's a good system. And if
Mhm.
anybody's interested in Find It, Fix It,
Mhm.
just look in your
Yeah.
app store for it.
Yeah, you
right?
can find it. Just write out "Find It, Fix It." It's a free app you can
Yep.
download. It's very easy to use,
It's
and you get so you do it after a while. You can make a report in less than a minute.
Right.
So it's
Yeah.
and then
Yeah.
it's so empowering. I tell folks, so empowering to see a result.
Mhm.
And I say it's a nice way, and I tell folks, these are all my tips for my personal safety talks, because I
Yes.
talk about resources like that. I talk about, if you're feeling like the city hasn't fully recovered, there's some areas that look a little rough and, or neglected, needs attention, you making that report and then you seeing it fixed. You see that bus shelter.
And they tell you.
Yeah, they tell you.
They email you.
And then you go to that bus stop the next day, like I did just recently, and you
Yep.
see that it's cleaned up, the mess that was there that was making
Yeah.
it an unpleasant place to be. It's very empowering.
Yeah,
And
it
so
really
we
is.
all need a little lift, I
Yeah.
think. So
Yeah, I
sign up for
agree.
Find It, Fix
We
It,
all
use
we're
it.
all part of it.
Yeah.
And like even something like the street light was out
Yep.
here
Streetlights.
a couple of weeks ago,
Yeah.
and they fixed it.
Yeah.
Because I put it
Yeah,
on the app,
it's-
and
We've got it down.
yeah.
Customer service.
Yeah.
City's customer service bureau, I think they're
Yeah.
called. But yeah,
Yep.
they do a great job. It's a
Yeah.
good service.
What else would you like to share with people?
Community. I call it the force multiplier when it comes to safety. And that could be community where you work, it could be community where you live, or community where you socialize. If you make that effort to make some connections and then communicate with each other around anything, especially anything that relates to safety, I say that do that. Because it'll make those places where you spend the majority of your time safer if everybody's doing that. And always reach out to the Seattle Police Department for support. We're there, and that's what we're there for.
Yeah.
Make the 911
You can't
call
do
if
it
it's an
alone.
emergency. Yeah, but yeah.
Again, I don't know if you're the right person to ask this, but I'm going to ask it. I know that police department numbers went way down during COVID. It was like 50% of the force, I think.
We lost a lot. We
a
lost
lot.
it, and it was in the year of 2020, and it was
And it's being built back. Do you know where we're at on that, or should I ask somebody else that question?
I know. I'm hearing that we're finally seeing numbers going in the direction we hope. But I would, other than that, I will defer you.
That's okay.
Refer you to the
I thought I'd ask.
HQ folks. But I heard, that's trending positively in terms of hiring.
That's
which is great. Let me tell you, folks, if anyone's thinking about a career, an exciting career, I think law enforcement is it for you because it's definitely it pays well. It's never boring. You're active. So people, if you're in retail, construction, or you want something changed, different, not to poach from your program, but it's a way to help people in their neediest moments. And I work with a lot of really compassionate folks at the precinct and in our department, and so being able to come in and help and stabilize or take action that's needed to help people in those moments is important. And then I think hopefully we'll make the whole part, all the other parts of the criminal justice system work together. In a way that supports people that get involved in it in their life trajectory to improve their trajectory after that involvement. Like I just heard recently some of our command staff attended the drug court graduation, and hearing the stories, they shared it with the whole department that it was just so moving because it's really good for that information to come back because the officers that work patrol every day don't necessarily get to those events, so they don't know.
They don't always see the outcome
for maybe 5 or how many times for open narcotics or something like that. Maybe this person a year or two later is finally gone through all the steps, and their life trajectory is suddenly in a very different direction.
I'm hearing really good things about drug court here.
So I feel like there's a lot of good stuff, and there's ideas, programs, but everybody's help is needed. And the other thing I tell folks too is, look around your community to get involved. Let's really work on the local level to make whatever you can and participate in any way you can to make it better. People doing the work you're doing, your crew, and then people providing permanent supportive housing and other kinds of services. They all. They probably have opportunities for volunteers or at least board members and things like that. So,
Well, Barb, thank you so much for being here today. I appreciate your work and that you bring us all together, and we're getting rid of the silos little by little.
I'm so glad you're here.
Thank you.
I enjoy partnering with you on things in the future too.
Thank you.
Thank you.
I appreciate you. Okay, well, thank you so much, and we're going to take a quick break. And on the hour, I have a Zoom call with the CEO of the Dallas Rescue Mission, and he's also doing a conversation on the bench today. And we're just going to do a quick Zoom and talk about homelessness in different cities. So we'll see you in a little while.